The first step to looking good is fresh and even-toned skin. I'm not an expert on this subject, but we have some folks here that are. A good step in the right direction is getting rid of facial and spider veins. So here with some treatment options for us, Dr. Norman Bine and Maria Bine from St. Louis Vein Specialties. Good morning to you, too.
Good morning.
Great.
You know we love having you by, so we appreciate you coming by.
We appreciate the opportunity to inform people on just what's going on, what they can do for themselves.
As we head into these colder months of winter, is there a reason why now is a better time to think about having something done about these varicose veins?
For all types of veins, not just varicose veins, winter is a great time because there are compression hose involved. Middle of summer in St. Louis is not the time.
To be wearing
earlier in
compression
the
hose,
year
that's
is
true.
actually better for varicose veins because there are certain guidelines they need to follow for their insurance coverage if they're medical. For cosmetic, of course, summer you're going to expose your legs, and it is a series of treatments. There is no magic. There are some very good treatments out for just the very, very surface veins, but if you don't treat the deeper cause of the spider veins, you won't get long-term results.
I would love to ask you about this issue of the cosmetic versus the medical, because I think a lot of people shy away from doing anything about this because they're afraid there's going to be a very high cost involved, there's going to be a lot of out-of-expense to them personally. But doctor, sometimes this is an insurance issue, isn't it?
This is almost always insurance when it's a medical cause for the underlying problems. When we talk varicose veins, we're talking about an underlying problem, and although you and your physician may think it's cosmetic, it is not. Medical insurance will cover the treatment of symptomatic varicose veins, the heaviness, the aching, the tired, the feeling bad at the end of the day, which you just offer up and say, well, I guess I'm getting older. But when we see these problems in 20-year-olds, we know that this is a medical problem. We cover everybody, including Medicare, and these insurances pay for these treatments. They're all done in office, no hospital work.
You mentioned 20-year-olds that exhibit some of these physical signs. What brings this on? What are the risk factors? What makes you more prone?
The thing that makes you most prone is heredity. It's better if you choose your parents a little more wisely, but you do...
Where were you 33 years ago, Dr. Bine?
Well, you get your varicose veins from your parents, and you get your insanity from your children. Everything is hereditary. Everything is hereditary.
Very good.
Importantly, it's not whether you're standing at work, whether you're sitting, whether you don't exercise, whether you do exercise. It's more a matter of heredity, period.
Okay.
That is the underlying problem. There's nothing you can do one way or another. Evaluation makes the most sense. We can tell you on an ultrasound evaluation at our office just what your problems are. And let me add that there are a lot of men out there with the spider veins of their nose that are being mistaken for other problems when actually it's wind and sun damage, and this also needs to be treated by laser in the office.
And that can be more of a problem in the winter than some of our other seasons, too.
Very much so.
Maria, we're seeing some before and after pictures here of spider veins in particular. We talk about the underlying medical necessity of this, but we shouldn't ignore the fact that it really does make an amazing aesthetic difference, the things you guys can do.
It does, and it makes a lot of impact on your ego, your presentation, your confidence, staying fashionable if you're younger, and even in older people. There's no reason why when we get a little bit older, shouldn't have decent-looking legs also. But they can be on the face. You do need to treat the underlying cause, which is usually what we call feeder veins. These are all considered cosmetic treatments. But for long-term results, you don't want to be going back every season. You don't want to be going back for a whole another series of treatments. Good long-term closure can be 2 to 3 years. You may get new ones.
That last picture we showed everybody there just a second ago, it looked like you were branding someone with the letter C, but in actuality, that's one of the diagnostic tools you use.
That's one of the tools that we use to see that's the picture. That shows us why you have recurrence of these veins when they're treated. We treat the underlying problem, which in that picture shows you what's called a feeding or reticular vein. We inject those. They're just very superficial, but you cannot see them on the surface. We inject those, and then the spider treatments will work, and they'll stay worked.
It's a medical issue, it's a cosmetic issue, but you're looking at two people that can take care of both in one fell swoop. And they'd like to talk to you if you think you might have some of these issues. So Vein Specialties offering some free screenings very, very soon. You can make an appointment for a free screening at their Creve Coeur office on December 1st, or check out their Washington office on December 7th. There's not a ton of spots left, but it's still worth picking up the phone and checking out if you're worried about this. Just give them a call, 314-993-8233. Or toll free on their nickel, 866-626-VEIN. Dr. Maria, thank you both for being here.
Very
Happy
welcome.
Thanksgiving.
Same to
Wonderful
you.
Thanksgiving.
Same to you. We appreciate it. Kent?
So it was the veins from your parents, the insanity from your children.
Okay, and I couldn't agree more.
So true, so true.
I've always wanted looking for somebody to blame.
Yeah, now we know. Now we know.
That's right. Well, still to come, what do Hugh Hefner and Betty White have in common? We're talking about other than that one night of wild drinking and poor judgment back in 1954.
Wow.
They are octogenarians. That's right. We're talking with the author of this book, Unexpectedly 80, about why turning 80 ain't so bad. Plus, we're cooking it up with these guys.
We're barbecuers. He's an Iron Chef, so it's a pretty big deal.
The Food Network show Food Feuds is looking for the best ribs right here in St. Louis. So what did they find? That's coming up after the break. And don't forget to enter our Creve Coeur camera photo contest. Send us your favorite outdoor photo for a chance at winning a $25 gift card to Creve Coeur Camera. Email your photo to greatday@kmov.com. Please include your name, age, address, and phone number. The deadline to enter is tomorrow, and we're going to show the winning picture Friday.